Imagine a health issue quietly progressing within your body, without a single whisper of warning or a hint of pain. It is often referred to as a silent disease because its effects are not immediately felt. Yes, absolutely. You can indeed have low bone density, a condition often referred to as osteopenia or osteoporosis, without experiencing any noticeable symptoms at all. In fact, this silent progression is very common, making it a significant concern for many. The reason for this quiet progression lies in the very nature of bone loss. Our bones are constantly undergoing a process called remodeling, where old bone tissue is removed and new bone tissue is formed. However, when old bone is removed faster than new bone is built, your bone density gradually decreases. This process usually happens silently because bone tissue itself does not have nerves that signal pain or discomfort as it slowly weakens. The internal structure of the bone deteriorates over many years, often reaching a critical point before any external sign becomes apparent. Since there are no obvious symptoms, you might wonder how people discover they have low bone density. The primary and most effective way is through a specialized imaging test called a DEXA scan. Doctors often recommend this test for individuals who have specific risk factors, such as being postmenopausal, having a family history of osteoporosis, taking certain medications that affect bone health, or having certain medical conditions. This proactive approach to testing is vital for early detection. It is important to understand that often, the first real sign of low bone density is what medical professionals call a fragility fracture. This means a broken bone resulting from a fall or a bump that would typically not cause a fracture in someone with healthy, strong bones. When this occurs, it is a clear indicator that the bone density was low for some time prior to the injury. This underscores why proactive screening and understanding your risk factors are so critically important. Understanding that low bone density frequently occurs without any symptoms highlights the immense importance of discussing your personal risk factors with your healthcare provider. Regular screenings, especially for those at higher risk, are your best defense against this silent threat. Taking these proactive steps allows you to protect your bone health effectively and prevent serious, debilitating fractures before they ever have a chance to occur.